In this video, we are going to talk about what kind of healthcare does the US have. So before starting, please like this video and subscribe to this channel for our future updates. Among advanced industrialized countries, the United States healthcare system is unparalleled. The United States lacks a uniform healthcare system, does not have universal healthcare coverage, and only recently approved legislation requiring practically everyone to have healthcare coverage. The U.S. healthcare system is best described as a hybrid system, as it does not operate a national health service, a single-payer national health insurance system, or a multi-payer universal health insurance fund. In 2014, private funds accounted for 48% of healthcare spending in the United States, with consumers accounting for 28% and private enterprises accounting for 20%. The federal government was responsible for 28% of spending, while state and municipal governments were responsible for 17%. Even if it is sponsored by the government, the majority of healthcare is given privately. In 2014, 283.2 million people in the United States had health insurance, accounting for 89.6% of the population, with 66% of workers covered by a private health insurance plan. In 2014, the U.S. government provided coverage to 115.4 million people, or 36.5% of the population, through Medicare, 50.5 million, Medicaid, 61.65 million, and or Veterans Administration or other military care, 14.14 million. People may be covered by more than one government plan. In the United States, nearly 32.9 million people lacked health insurance in 2014. This fact sheet will compare the United States healthcare system to those of other advanced industrialized countries, with a focus on the issues of high healthcare prices and insurance coverage gaps in the United States. It will then go over some typical strategies used in other countries to reduce healthcare costs, look at the German healthcare system as a model for non-centralized universal care, and compare and contrast the quality of healthcare in the United States in comparison to other OECD countries. The Organization for Economic Cooperation and Development, OECD, is a global development organization that brings together 34 member countries to compare and discuss government policies in order to support policies that would improve the economic and social well-being of people all over the world. The countries that make up the OECD are mostly advanced or rising economies. The governments of the United States and Mexico contribute the smallest roles in overall healthcare financing among the member states. However, with the exception of Norway and the Netherlands, the United States spends more per capita on healthcare than any other OECD country. This seeming anomaly is due, in part, to the high cost of healthcare in the United States. Indeed, the United States spends far more on healthcare than any other OECD member. According to the OECD, the United States spent $8,713 per person, or 16.4% of GDP, on healthcare in 2013, significantly more than the OECD average of 8.9% per person. The Netherlands, which spent 11.1% of its GDP on healthcare in 2013, was followed by Switzerland, which spent 11.1%, and Sweden, which spent 11% of its GDP on healthcare in 2013. Canada and Mexico spend 10.2% and 6.2% of their GDP on healthcare, respectively, in North America. Health insurance in the U.S., uneven coverage. Although the majority of Americans have health insurance, costs are rising and the quality of policies is deteriorating. Between 1999 and 2005, average yearly premiums for family coverage grew by 11%, but have since leveled off at 5% per year between 2005 and 2015. Deductibles are increasing at an even quicker rate. Single coverage deductibles increased by 67% between 2010 and 2015. Both inflation and labor pay are outpacing these figures. The lack of health insurance coverage has a significant economic impact on the United States. In 2009, the Center for American Progress calculated that the cost of not having health insurance in the United States was between $124 billion and $248 billion per year. While the low end of the projection just includes the cost of people without insurance living shorter lives, the high end includes both the expense of shorter lives and the loss of productivity owing to the uninsured's poor health. Minorities and the poor are frequently underserved when it comes to health insurance coverage. Nearly 2 out of every 5 workers, or 40 million people, do not have access to paid sick leave. According to experts, the financial temptation to work even while sick can extend pandemics, impair productivity, and raise healthcare expenditures. In 2014, there were 32 million uninsured Americans, down 9 million from the previous year. The complete implementation of the Affordable Care Act (ACA) in 2014, according to experts, is to blame for the steep drop in the uninsured. In 2014, 73% of American individuals with health insurance had one or more full-time workers in the household, while 12% had one or more part-time jobs. In 2014, just 49% of American individuals said they had health insurance through their employment. The amount of coverage offered by employer-sponsored insurance varies greatly depending on the wage level. Firms with a higher proportion of low-wage workers are less likely than those with a lower proportion of low-wage workers to provide health insurance. In 2014, 11.2% of full-time employees lacked health coverage. However, thanks in part to the Affordable Care Act, the percentage of part-time workers without insurance fell to 17.7%, down from 24% in 2013. Unemployment among individuals who had not worked for at least 1 week fell from 22.2% in 2013 to 17.3% in 2014. Smaller businesses are much less likely to offer health benefits to full-time or part-time employees. In 2015, only 56% of small businesses, 3 to 199 employees, offered health insurance, compared to 98% of large businesses. After the Affordable Care Act allowed many young adults, 19 to 25, to stay on their parents' health plans, the percentage of covered young people increased statistically significantly from 68.3% in 2009 to 82.9% in 2014. The percentage of young individuals aged 26 to 34 who had insurance climbed from 70.9% to 81.8% within the same time period. Minorities and children have a disproportionately high rate of uninsured people. In 2014, 7.6% of non-Hispanic whites were uninsured, 11.8% of blacks were uninsured, 9.3% of Asians were uninsured, and 19.9% of Hispanics were uninsured. According to the Kaiser Family Foundation, about 80% of the uninsured are citizens of the United States. In 2014, 6% of youngsters lacked health insurance. These kids are 10 times more likely than insured kids to have unmet medical needs, and they're 5 times as likely to go more than 2 years without seeing a doctor. For the same coverage, women in the individual market generally paid greater premiums than males. The Affordable Care Act, which went into effect in 2014, prohibited this practice as well as denying coverage to anyone with pre-existing diseases. In 2014, 19.3% of the population living below the poverty level, $23,550 a year for a household of 4, lacked health insurance. According to the Kaiser Family Foundation, 90% of uninsured people have family earnings that are less than 400% of the federal poverty limit. This qualifies them for subsidized insurance through tax credits or increased Medicaid coverage under the Affordable Care Act state health exchanges. Rising healthcare premiums. Premiums for health insurance in the United States are rapidly increasing. Between 2005 and 2015, average annual family health insurance premiums climbed by 61%, while worker contributions to those plans increased by 83%. This rate of increase is faster than both inflation and pay increases. In 2005, the average annual rates for employer-sponsored health insurance for a single person were $2,713 and for a family of 4 were $8,167. Premiums for employer-sponsored single coverage increased to $6,251 in 2015, and premiums for employer-sponsored family coverage increased to $17,545 in 2015. For individual insurance, an increasing proportion of workers face deductibles of $1,000 or more. In 2015, 46% of workers were enrolled in a plan with a $1,000 or higher yearly deductible, up from 38% in 2013 and 22% in 2009. Small business employees are more likely than large business employees to have a deductible of more than $1,000. What do you think about our video? Please let us know in the comments area below. If you enjoyed this video and would want to hear from me again, please subscribe and turn on the notification before leaving. Thank you for watching us.